Hello, I'm Berkman Albayrak. I'm the prosthodontist of Koradent Clinic. Today I'm going to talk about the immediate implant placement. When the patients come to us and apply for implant treatments, firstly we're taking X-rays, sometimes panoramic, or if we're making a full mouth restoration. We need to get tomographies first, and we are making the planning first with our surgeon, and I'm making some try-ins first to replace the missing teeth, and we are discussing all the treatment phase before the initiation of the intervention. When you come to us after our discussion, we are mostly producing the temporary crowns or temporary prosthesis first, and then we are getting to the procedure of surgical phase. And in the surgery, we are extracting the teeth, and immediately we can insert the implants if there is no recent infection in that area, so that we can protect that surrounding area, the bone and the gum, and we can establish the emergence profile desired, so that we can obtain beautiful aesthetic outcome in the permanent stage. And right after the implant placement, we can apply the temporary prosthesis inside the mouth, and the patients can go back their country for maybe 2.5 or 3 months for the osseointegration of the surrounding bone. And when the patient come back again, we can remove the temporary prosthesis, and we can switch it with the permanent one. So sometimes we can make some removable prosthesis as temporary ones, or sometimes we produce temporary removable prosthesis first, and then we can modify it and we can change it to a fixed prosthodontics. Our patients during this 3 months, this osseointegration time, they can easily use their prosthesis during the function, or the aesthetic outcome would not be compromised. And after this 3 months, again, we can, like I said, we can switch the material. So after the extraction of the teeth, if the surrounding bone gets out of function, the bone resorption can encounter some extreme bone resorptions. That's why we prefer to insert the implants immediately after the extraction, so that we can obtain some function in that surrounding bone, and the bone resorption would not be that much, and we can easily make the permanent teeth. That's the advantage of immediate implant replacement. If there's no infection in surrounding bone, so it's really available to do the immediate implant insertion, and no one wants to stay without teeth. No one wants to stay edentulous. So during this treatment, you can use the temporary crowns or temporary restorations. You're not supposed to concern about the aesthetic outcome. So if you seek to implant treatment, and if you can send us a tomography or a panoramic X-ray, so that we can establish a comprehensive treatment plan here with our team. And then when you come here, we can proceed very fast. We can start with the production of the temporary restorations, and right after the implant placement, you can have your temporary restorations and go back to your country. And when you come back here in 3 months, so that immediately you can have your permanent restorations again. So if you're concerning about staying edentulous during this treatment, you can discuss it with your dentist, and you can demand immediate implant replacement, so that you shouldn't concern about static result, and so that you can achieve a long-term success. Thank you for listening to me. Take care. Bye bye.